tonight. The latest plan to bring financial relief to Americans passes the Senate.
We want to make sure this money is available to small businesses that need it.
What's next as Washington works to steady the economy in the wake of the coronavirus outbreak? And is the U.S. facing a food shortage?
I think this can be as soon as next couple of weeks. We can see the shortages, especially in the pork categories.
How farmers are responding to the growing concern. Plus, coronavirus and the military's ability to defend the United States. All this and more tonight on Faith Nation. Washington's next moves to help struggling Americans. Welcome to Faith Nation. I'm Jenna Browder. Tonight, Congress is looking at phase 3.5 of a coronavirus relief bill, nearly $500 billion to help small businesses and hospitals. Tonight, it's been passed by the Senate and is on its way to the House. And that is where we begin with CBN's Capitol Hill correspondent, Abigail Robertson. Abigail?
That's right, Jenna. House leadership has asked all members who can travel to be back here in D.C. by 10 a.m. tomorrow when they will pass this aid bill. Now, originally, they were also going to take up another bill that would allow members to vote by proxy going forward, but due to bipartisan disagreements, that's no longer going to be on the table for tomorrow, and instead the focus will just be getting this aid bill across the finish line.
This is a real victory for smaller businesses, as a leader has said, who really didn't have the banking relationships, but they don't need them under this legislation as it is passed.
And before this latest relief package even hits the president's desk, talks are already underway for more help, which Speaker Pelosi says will support frontline heroes.
We have healthcare workers, transit workers, police, fire, EMS, all kinds of public employees who risk their lives to save lives and now lose their jobs. And this is most unfortunate.
But Senate Majority Leader Mitch McConnell cautions more big spending will require more thoughtful review.
My view is we've gone so far on the national debt here that the next time we address this issue, the Senate should be back in session, fully up and running, with everybody involved in the discussion.
President Trump plans to sign the latest legislation when it reaches his desk, and he also announced a 60-day suspension on immigration into the U.S.
By pausing immigration, we'll help put unemployed Americans first in line for jobs as America reopens. So important. It would be wrong and unjust for Americans laid off by the virus to be replaced with new immigrant labor flown in from abroad.
The president says this will only apply to those seeking permanent residency and will not affect immigrants seeking temporary jobs in industries like farming and fishing. There will also be exceptions made for workers, essential employees like healthcare workers. Back to you, Jenna.
All right, Capitol Hill correspondent Abigail Robertson, thank you. And here now for more is CBN's chief political analyst, David Brody. David, we're already seeing the political finger pointing with this newest phase of the stimulus package. Who do you think is winning this fight politically?
Well, I think ultimately it's a wash as it relates to the American people. As a matter of fact, Jenna, what we have seen, and I know this is going to shock you, have a seat. Well, I guess you're already sitting. But 30% of Americans actually now approve of the job Congress is doing. That's up from a whopping 16%. So, hey, hooray for Congress. And why are the approval numbers up? Well, because money is coming into people's pocketbooks. And I think that usually gets the numbers up. So I think ultimately, despite all the finger pointing, and believe me, Republicans have some talking points here. The fact that Democrats stalled this bill for a couple of weeks, I think ultimately it's all going to be a wash, Jenna.
You mentioned that poll about Congress. There is some concern, though, for the president in recent polling. More than 70% of Americans say people should stay at home until doctors and public health officials say it's safe. That includes, David, a majority of Republicans, too, about 55%.
Right. It's a big concern and a big gamble by this president. You know, I know he's saying slow as America, goes. But the truth of the matter is he's got an itchy trigger finger here, and he wants to get this thing moving probably faster than you even see it now. But the polling, as you just suggested there, show that The public's not quite there. So it's a big gamble for him politically. Let's remember, while some cities and counties have flattened the curve, most cities, counties, states have not done that, Jenna. I mean, there's been 25,000 new cases of the coronavirus just in the last 24 hours and 2,500 deaths. So there is a long way to go here.
David, why do you think the president is in such a rush to reopen the economy? Final thought.
Optimism. That's what he does everything, right? You know, do you notice every time he talks about a subject, right, it's always just like, it's going to be fine. If North Korea blows us up, that's not good. But if they don't, that's okay. You know, in other words, everything's just, it's okay. It's going to be fine. We'll get through this. The bottom line is that he loves optimism. And the truth of the matter is, if we're up to public health officials, they would probably keep us all quarantined for the next year or so. But Donald Trump says, no way. This economy is in shambles, and he wants to see it open right away. He knows that there's an election coming around in November, and he's got to get this thing back on track.
All right, David Brody, we'll leave it there. Thank you. Good to see you.
Thanks, Jenna. Good to see you.
Nursing homes and long-term care facilities have been hit especially hard by COVID-19. Multiple factors put them in greater danger of outbreaks, things like age of residents, underlying chronic conditions, and close living quarters. And the Trump administration is trying to curb the spread of disease at these nursing homes. Seema Verma is the administrator for the Centers of Medicare and Medicaid Services and a member of the White House Coronavirus Task Force. Today, she spoke with CBN White House correspondent Ben Kennedy about new guidelines for nursing homes.
Well, nursing homes have been ground zero for COVID-19, and as states begin to reopen, new steps are being taken to protect those in nursing homes during the pandemic. Joining us now is CMS Administrator Seema Verma. Seema, thanks for being with us.
My pleasure. Thanks for having me.
Well, tell us about this new announcement by CMS.
One of the things I will start out by saying is that our hearts and minds go out to the patients and the family members. This has been a very difficult time for our nursing home residents. And our announcement this weekend was all about transparency. We want to make sure that patients and their families have the information that they need to make decisions and just to have a better understanding of what's going on in the nursing home. And then secondly, we are having nursing homes directly report information into the CDC. Now, we've had long-standing regulations about making sure patients know what's going on with their family members, and they're also supposed to be reporting into the local health department. But as part of our overall effort to opening up the country, we are working on making sure we have a very solid surveillance system across the country. And that means we're monitoring individual communities to see if there is an outbreak. And by monitoring nursing homes, we'll have a better understanding of what's going on in the larger community. And so these efforts around reporting into CDC are not only about keeping patients safe and providing better transparency about nursing homes, but it's also about protecting the entire community and doing what we can and supporting local officials' efforts to mitigate the spread of the virus.
South Carolina is easing restrictions. Georgia, Tennessee will be following suit. What kind of impact in states reopening, does it put nursing homes at greater risk?
Well, one of the things that we've put in the recommendations that Dr. Birx talks about in terms of opening up the country is that we want to make sure that we have that surveillance system in place and that we are focused on nursing homes because we know that they're the most vulnerable. So we have to make sure that they're prepared and that we have that surveillance system in place. And so those reporting guidelines will go a long way to supporting efforts to opening up the country.
When the coronavirus first hit, we saw the devastating impact it had in Washington State, in the nursing homes there. As we begin to reopen the country, there is a chance, a possibility of a second wave of the virus if and when it does in fact hit the country. Are there steps or a plan being put in place now in the event that does happen to protect people and as well as nursing homes?
Absolutely, and I think we're going to be in a different place. We've seen a dramatic increase in testing. We have learned more about this virus. You have to always remember that this just started less than 6 months ago. We didn't even know about this virus in terms of the entire world not knowing. And so we're learning information, and as we learn that, we are constantly updating our recommendations and our guidelines. That's going to be very important to nursing homes that are on the ground that have that primary responsibility of keeping patients safe. But it's also that data and information is informing our larger efforts. But we will be in a different place because we'll have testing. We're also doing a lot of efforts to beef up contact tracing. so that if there are some new cases that come up, that we can very quickly make sure that we're doing contact tracing, isolating individuals, and we're hearing every day about new therapies that are also going to be available. So I think we'll be in a different situation if we see a reoccurrence of the virus. But it's important to know, virus isn't going anywhere. It's going to be a part of our healthcare system. It's going to be part of the things that we can potentially catch. The important thing is to make sure that we have a system in place to mitigate the spread of the virus, to make sure that our healthcare system doesn't get overwhelmed, and that we're doing everything we can to keep Americans safe.
Seema, you are part of the coronavirus task force. I've been in the briefings. I've heard from you. I've seen you standing beside President Trump. What has been the biggest challenge in combating and fighting this pandemic?
Well, you know, I got to tell you that there are challenges, but I've also been just enormously impressed with how the American people have responded to all of this. The recommendations that we put out, 15 days to slow the spread, 30 days to slow the spread, the American people have responded, and it is making a difference. We're seeing all across the country that many communities are seeing fewer new cases. We're seeing reductions in hospitalizations, which is why this weekend we also talked about reopening the healthcare system. We've done a great job with telehealth, but there are just some healthcare services that can't wait anymore. But it has been a major impact. I think the economic impact has been also something that people have just really suffered from. And so I appreciate the fact that the president has had not only a public health response, but also an economic response. Just, you know, last night we heard about new legislation that was passed to provide more capacity around testing and more support for our small businesses as well as hospitals.
Seema Verna, thank you for joining us.
My pleasure. Thank you.
Is America in danger of running out of food? Up next, the growing concern and how farmers are working to ease those fears.
To have sex before you marry is a bad idea.
Don't tell me there's no such thing as gun violence.
That just depends on your definition of when life begins.
Watch Dan and Dale tackle trending topics that test your faith on the next Faith Wire, Monday night at 9:30. The Global Lane takes you around the world, providing facts over fiction.
What might rising trade and geopolitical tensions mean for you on the home front?
With over 45 years of experience, award-winning journalist Gary Lane brings you the truth from a global angle.
What about the issue of immigration?
World news analysis you won't see anywhere else.
And it's all right here on the Global Lane.
Watch The Global Lane, Thursday night at 9:30.
COVID-19 is spoiling the meat processing industry. Tyson's announcing today it's closing its largest pork plant. It's the latest of at least half a dozen meat packing plants closing nationwide, leading to growing concern about our nation's food supply. Caitlin Burke joins us now for more. Caitlin, these closures are posing a problem for both farmers and consumers.
That's right, Jenna. Across the country, meat processing facilities are closing their doors because of COVID-19 outbreaks. Bad news for the farmers who depend on them to get their meat to market, and to consumers who expect to find their grocery store shelves stocked.
When you disrupt the front of the supply chain, it ultimately disrupts the back end of the supply chain.
And we're seeing that as massive processing facilities close their doors after COVID-19 outbreaks. The impact expected to soon hit consumers.
I think this can be as soon as next couple of weeks. We can see the shortages, especially in the pork categories.
As millions of consumers find empty store shelves, farmers and other suppliers are being forced to throw out food normally sent to schools and restaurants.
Worked so hard, and then all of a sudden it's flushed down the drain.
While the Agriculture Department works to help farmers distribute food directly to the public, shoppers are getting creative.
I couldn't find avocados at the grocery store this week, but they were available through Panera Grocery.
Restaurants are now selling items that they can't serve to diners. Many hope that by offering staples like fresh milk and produce, customers will also add other menu items to their orders.
Farmers who serve their local communities say business is booming, but they've had to get creative when it comes to figuring out how to get their products into the hands of their customers.
John Morisani of Laurel Ridge Farm in Litchfield, Connecticut, began selling his beef and pork at his farm stand when COVID-19 restrictions shut down the local farmers market.
We've had farmers markets where, you've had 3 sales for a 4-hour market. In here, we've been actually very busy the entire time that this has been going on. It's definitely, and I've gotten a number of orders for quarter cows, half cows, and that kind of stuff. I'm basically, our bulk stuff, we're sold out through June.
Some other Connecticut farmers teamed up to launch a virtual farmers market.
Instead of stopping at our farm or at our table at a farmer's market, they stop at our web page, order what they want from our farm, and then there's a link on my web page to go order from the next farm. And they'll go about, they pay 1 delivery fee for, getting whatever they want from 4 to 5 farms. And it's a win-win for everybody, I think.
It was supposed to be a one-weekend thing to replace the annual Easter farmers market, but demand was so high, they've decided to keep it going. Farms like Mapleview and Laurel Ridge use local meat processors rather than major plants. So far, there have been no disruptions, allowing these farmers to work to meet the community demand. They hope the quality of their product keeps customers coming back long after the pandemic eases.
Wherever somebody's watching this, I'm sure you have a local farmer somewhere in your backyard that you might not know about right now, that you can just go see how are they preserving land, how are they tending to their land, how are they treating their animals, and these things are just so much more transparent when you're buying directly from the farmer than when you're buying, meat from a grocery store.
You can tell these farmers are excited to educate people about where their food comes from, and they really hope to continue to have that support from their communities in the good times as well as the bad.
Yeah, Caitlin, great story. How well equipped are these farmers to meet the growing demand for meat and produce?
So a great question to ask local farmers in your area is how often they take meat to be processed. As I mentioned in the story, these smaller farms are using local processing facilities, but before this pandemic hit, they had a schedule set up with their local processor. So if you found a farm that only goes to the processor once a year, that may be a farm that did not plan for the increased demand, obviously, as none of us could. And so they may start to run low on some of the meat that they have to offer. But if it's a farmer that goes every few weeks, every few months, which many do, I found several in this area who do, they're a little bit better equipped. So ask questions. They're happy to talk to you about what they do and eager to help.
All right, Caitlin Burke, thank you very much. Well, COVID-19 and military preparedness coming up. Are our troops ready? You're watching CBN's Faith Nation.
on the home front.
Thanks for joining us for CBN's On the Home Front, where we highlight what the men and women of America's military do to defend our country. CBN honors the men and women in our military with an initiative called Helping the Home Front. It partners with churches across the country to meet the needs of their military families, from repairing homes to wiping out medical bills for wounded veterans.
On the Home Front, Tuesday morning at 10:30.
If you want to be an attorney with a passion for serving people and for excellence, Regent University needs to be high on your list.
Regent's award-winning law school doesn't just create lawyers. We create leaders, judges, prosecutors and defense lawyers, civil litigators, and leaders in government.
My focus has been trying to really make sure we have the future leaders we need for the bench and the bar and for society generally.
You'll learn from highly credentialed leaders who are current and former judges, distinguished scholars, and ACLJ counsel.
I'm so glad I chose Regent. The relationships here have been amazing. The faculty have been amazing. Not everybody's called to the same thing when they leave law school, but they're called by a God who has a purpose for their lives, and He is going to use that education to make a difference in the world.
Regent will prepare you to be a purpose-driven, practice-ready lawyer. To start your rewarding law career, complete the online application, submit your transcripts, and take the law school admissions test by July. Apply today.
Welcome back. The U.S. military is feeling the effects of the coronavirus pandemic. Troops and their families infected with the disease is only scratching the surface, only part of the story. CBN News national security correspondent Eric Phillips joins us with that. Eric?
Well, Jenna, you said it best. We saw how quickly this illness can spread in tight confines. For example, aboard the USS Theodore Roosevelt during the saga there. But one military expert tells me that it's important to take a look at really the big picture. What happens beyond this current crisis? And he says it's important to do everything we can to prevent the spread of what he calls the slow erosion of our military superiority.
We're going to have a pivotal moment whether the United States is going to reclaim or relinquish our military superiority in the next 2 to 5 years.
Bradley Bowman studies U.S. defense strategy and policy. He fears the American military is in danger of being replaced as the world superpower.
There are areas where the Chinese or Russian military have capabilities that are more advanced than ours, and it pains me to say that.
Bowman says for years, updating equipment took a backseat to the war on terror. He says only in the past few years has a focus been put toward research and development. The results of that work will be ready to implement in the next few years unless the COVID-19 strained economy puts it on the back burner.
And so what that means is we will have done all this research and development efforts and got all these systems ready to field to our troops who desperately need them, and then we're not going to be able to afford to provide them. And I fear what that could mean. I fear this gravely, a historic kind of end, if you will, to U.S. military superiority.
Meanwhile, Bowman warns our adversaries are consistently looking for weakness. He points to Russia, that even in the middle of a pandemic, is still sending nuclear-equipped bombers to test our defenses in Alaska.
Their assessment of our strength is that we are getting, relative to them, weaker and weaker, and that's going to invite the very thing that we are designed to avoid.
And while Bowman says this is indeed an urgent situation, he wants to stress that right now, the U.S. maintains sufficient combat power to protect the American people and our interests abroad. But he says we want to keep it that way. And COVID-19 certainly presents more challenges to that end. Jenna.
All right, a challenge indeed. Eric, thank you. Still ahead, a story of survival, how one woman is crediting God after beating coronavirus.
If you want to be an attorney with a passion for serving people and for excellence, Regent University needs to be high on your list.
Regent's award-winning law school doesn't just create lawyers. We create leaders, judges, prosecutors and defense lawyers, civil litigators, and leaders in government. Ready to become a purpose-driven, practice-ready lawyer? To start your rewarding career, complete the online application, submit your transcripts, and take the law school admissions test by July.
Nutrition, exercise, essential oils, weight loss, and more. It's Healthy Living with Lori Johnson.
Talk about what's in this.
Join CBN health reporter Lori Johnson to get the latest information from today's top health experts.
This is fantastic.
Find out what you need to know to live a healthier life. Watch Healthy Living, Tuesday night at 9:30.
Woohoo! Hi, Superbook fans. Here's something else you'll love. It's the new Superbook Bible app. It's packed with games, activities, and Superbook episodes that you can watch for free. Oh, no! There's trivia, a fun daily devotional, and answers to your Bible questions. Plus, an easy-to-understand Bible the whole family will enjoy. You can even create your own Superbook character. Ta-da! Whoa!
The Millsburg Falls man coming.
Sorry, pardon me. Sorry, excuse me. Ouch!
Are you getting this?
Earn super points to win daily prizes, too. And so much more! Time to get back to my adventures. See you soon. It's the new Superbook Bible app. Free downloads on iTunes, Google Play, and Amazon.
Finally tonight, living through the attacks of 9/11, then facing an attack of COVID-19. It is a story of survival for a couple CBN News introduced you to last year. Paul Strand brings us the latest chapter.
And the shock waves from the plane blasting into that building actually blew us back into our apartment.
Christina and Brian Stanton live so close to the World Trade Center South Tower that the 9/11 attack completely upended their lives.
Everybody's running around screeching and bumping into each other and catapulting over things. And I just remember looking at Brian saying, are we going to die?
The Stantons suffered health problems from the toxic dust for years, and their troubles brought them closer to God.
Our whole lives are changed because of 9/11. It certainly deepened our relationship with Christ.
Now they've spent the last month fighting the coronavirus after both tested positive.
It was definitely a battle, and you were very cognizant that you were in a battle for your life.
Christina almost died and had to be hospitalized twice.
Because the virus became overwhelming and it was something that I couldn't manage at home. I didn't have to be hooked up to a ventilator, and that was a big blessing.
Still, a doctor gave her a frightening prognosis.
Can you be honest with me and tell me what are my odds of surviving this? And he did actually say 50-50, which was a shocking thing to hear.
She realized it would take more than medical help to save her and put out a worldwide request for prayer.
When you have a temperature for over 100 degrees, it's really hard to pray or even string a sentence together. And I knew that there were people praying for me when I couldn't pray for myself. So prayer is everything. And I invoked the name of Jesus Christ quite a bit during this past month. And there is power in that name, and there is power in prayer.
Still in pain, Christina's humor remains intact, and she's rejoicing that neither 9/11 nor COVID-19 could take them.
It was another angle of Jesus being there when a near-death experience was on my front door yet again. I tell people New York keeps trying to kill me.
Paul Strand, CBN News.
And the power of prayer, we will leave it there tonight. Thank you for joining us. Have a great evening.